I'm also very closely associated with PGI Chandigarh for many reasons. I first came here in 1979 to write the PG entrance exam. I was number 22, but somebody from second position took up the psychiatry post. There was only one seat. Very strongly I was insisting on taking up psychiatry, then for a brief while at NIMAS and then at CMC Vellore. And I started my journey in sexual medicine. Two people at CMC Vellore, Dr. K. Kuruvilla, and at PGI Chandigarh, Dr. Avasti, and that team, what they had developed, pro forma and a whole lot of work that was happening. That was the beginning of my journey in sexual medicine. NCIASP, twice we have conducted at Mysore. And last time at a very short notice, but still I think we could succeed. I'm going to work with another PGI alumni, Dr. Savita Malhotra, coming here. Dr. Srinivas Murthy was my examiner. Dr. Vig was MCA inspector or something. In fact, we were so scared because when Dr. Srinivas Murthy is there, he is such a strict and each person we were not likely to pass. And over and above, Dr. Vig is there. So, chances that we won't pass. But luckily, they were very kind to me. I was Indian Journal of Psychiatry for 12 years, longest serving editor, I was told, but one person who almost acted like my right hand to help me in the journal work was Dr. Sandeep Grover. I must place on record the help from PJ in general and Dr. Sandeep Grover in this particular work. Dr. Savita Malhotra, in the beginning of the year, she told me, Rao, don't talk about sex when you take up psychiatry, this thing, presidenship. I had to tell her, but PGI Chandigarh, very sensitive to sexual issues and you have to be very careful. That's what I was told. So I have toned down my lecture to a great extent to match the sexual sensitivity of many of the PGI people here. Somebody was using the term pornography. Absolutely. Sexual medicine is a science. This is one of the, in fact, everything has something good and bad and some issues related to that. The other one is the field of sexual medicine is growing, and I'm extremely happy at the outset to just mention that in India, the only place where sexual medicine training happening is actually at JSS Academy of Higher Education and Research. We have fellowship program and diploma courses, and quite a few people from PGI are there. So this is another point I just wanted to wish. So I bring the greetings from Mysore. And this NND oration, when I was told that this is the oration I need to be giving, NND is actually something, when I took up as editor, one name which was actually very frequently, and at that particular time, the longest serving editor was Dr. NND, what I could make out historically. We prepared one book called as Icons of Indian Psychiatry. We had written quite a few things about many of the stalwarts, but those who are not there, but who had left their mark. In fact, this is the principle on which this particular thing was developed. And I still remember quite a few photographs put in there. And one of the articles from Dr. Sridhar Sharma about historical development of Indian psychiatry in general and Indian Journal of Psychiatry in particular. And one name that comes out again and again is actually Dr. NND, Indian Journal of Neurology and Psychiatry to start with. 1948, he took over as editor for this journal. And if you try to look at the topics and many of the things that have been covered, it is something extraordinary. In fact, one of the important is actually opportunities for psychiatric research in India. This is one important point we should remember. And lot of specialties are going to come up. I think that was the indicator, that seed what he had sown. And now in 2025, we talk about so many super specialization in psychiatry, so also different branches. One point almost always I make emphasis is actually sexuality is somehow we are neglecting. You look at many of the multinational company people, they don't come and talk to you about Viagra and lot many other things at all because they believe psychiatrists are the people who reached these medications. And because we are not showing interest, somehow we are losing a lot of branches, a lot of sections, and the sexuality is one. And now in ICD-11, sexuality, there is a special section taken off from psychiatry. Very justifiable reasons too. In fact, so many unjustifiable explanations are available. What has actually happened, in fact, from the morning we are listening to, that somehow social psychiatry gets missed out. The same story. I was there in one of the ad board program of one of the major multinational company. There were about 40 plus specialists, and everybody was talking about you establish endothelial dysfunction, give some medication, and you treat it. When I told whether all the problems will get solved that particular way, the whole issue was where we have time, where we have training, where we can monetize these type of things. This is one of the important points. Before I venture into female sexuality at this particular point, when Viagra was introduced, or maybe sildenafil, all men and women believed that all their problems are solved. 2 years later, there was a major study of over 2,000 plus couples from China. It came out with the report that hardly anything has changed. Now, at one hand, we have the idea that it is actually solving, but on the other hand, it has actually not made any difference at all at that. So what was missing, I'm going to talk about it as we proceed, and this particular what is missing is very specifically applicable for female sexuality. So this is actually another page from that particular thing which indicates Dr. N. Day was one of the important person who carried the journey of Indian Journal of Psychiatry, and this is one of the page. We have actually scanned and modified into Word and easily downloadable, accessible Indian Journal of Psychiatry website. Almost 60 plus years of Indian Journal of Psychiatry. Every page it is available there in indianjpsychiatry.org. So it documents a lot of things that were happening. And one of my editorials is actually how this particular journey has changed. And now we are editing another journal, Journal of Psychosexual Health, covering a lot of aspects, and very happy and proud to say that at present we are #1 in the global CH basket, so also probably in the world, because number of people who visited, downloaded, it is actually 8,09,417 in 2024. No other journal can come anywhere near. So this is one of the areas where we are actually working on for a pretty length of time. But you may wonder, what is this man talking about female sexuality? You got the point. First question. You may not believe many of the things what I will say. Second point is bias as husband, father, and son. One of the most critical person in your life would be actually wife. So I may have some of the ideas. Father, my daughter is psychiatrist, and I have seen actually how she goes up and what are the points. To my parents, my mother, psychiatry and sexology, and more than anything, still learning. And what I can do at this particular juncture is only very briefly a bird's eye view of some of the important points in this particular area. You may agree, you may not agree, but that's what actually the research says. And these principles have helped up to some extent. See, all my psychiatry doesn't work with my wife. You got the point. My wife says, I was so happy when I married you. That means all our problems started from the time of marriage. Another deadly statement she makes, if you really loved me, you should have loved somebody, married somebody else. You got the point. That means if this is the difficulty a sexologist is going through, you can imagine the amount of problems what other husbands and men actually in general might be going through. We are all well aware, ours is the land where a lot of respect for the woman is almost always there. One of the most beautiful phenomena in the world. I fully agree. And I will be taking over as President of Indian Psychiatric Society, and let me assure you that from this podium, this is maybe third time I am telling, minimum 30% of the post in my term will go to ladies. Maybe more, but not less than 30%. You can clap. So, this is what I have to do. Maybe, but all said and done, there is no person who is not political actually that way. So, wherever women are respected, God stays. This is the story. But all said and done, we are also aware, starting from our mythology, Vedas to lot many other places, of course, how women have been ill-treated. A range of reasons could be there, but important point is actually female sexuality in general. And when you are trying to talk about dysfunctions, there is a significant unmet need. What I will be doing will be next about few minutes trying to understand female sexuality. Then from our department, we have done quite a bit of studies and publications related to female sexuality. So this is the second point I'll try to cover briefly. Third one, in general, what are the things actually we need to do? How one has to be sensitive to the whole thing. Even males, page whether they'll come, this is actually one of the questions. But the important point is actually if a man has come, either his wife has sent him, or he is in love with another person, she told him go and get this thing. That means there are ladies behind. And many of the time people don't come and tell you that I am having sexual problem. This is the common story. You just give them one word, one question, one statement, whether do you have any sexual concerns to tell. 10% usually, but it becomes 50% if you just show a little bit of interest in understanding. And we tell, there are a few people who are part of our fellowship program and our training program. One of the most important emphasis is actually first we have to get out of our inhibition, we as doctors, and this particular change needs to come, and what we should have a proper understanding of what actually we are trying to do. So this particular picture shows what I am telling may be applicable to some people. You may be exceptions, there are quite a few people, the exceptions are bound to be present. And it all depends upon who you are and how you are looking into the problem. So this is important message. When you are trying to talk about female sexuality, one important area is we almost always talk we are equal or almost same, except that erection and maybe swelling and lubrication, all mechanisms are same. But what works in case of man just doesn't work in case of women. That means there has to be something actually, what is that actually we are missing in this whole story. A little historically, earlier days, things used to be very simple, that she is a girl and I am a boy, you are a boy, and you have something and she has something, very easy to understand like that. War between sexes, all the men's problems are because of the women. Sometimes I tell my wife, boldly when other people are there, that all my problems also started because of the marriage. When she is alone, I won't tell because I will get beaten up and a whole lot of things can happen. So when others are there for my support, sometimes I make this comment. So women as enemies, there was a time. Feminism, are men really necessary? This was one of the stories. Around mid-70s, in fact, one of the most revolutionary thing happened was actually oral contraceptive, which liberated the woman from whole range of clutches for which actually she was difficult to handle the life. And feminism, mobile and motility nowadays. In fact, earlier either brother or father, somebody has to be there. But now these two things have made remarkable changes. Men and women are equal. But all said and done, somehow we forget Freud. Freud mentioned that whatever we say, the woman's life starts with something actually missing. She tries to overcome this by a whole range of measures. We talk about Oedipal complex, we talk about Electra complex and many such other things. But all said and done, the world has changed so much. Sexes have recouped, revolutionary changes have happened, and now we are doing many of the work. In fact, I am almost expert in washing clothes, washing utensils, cooking some of the items. No, you got the point? I always tell my wife indirectly that men are good in sex. They should be utilized only for this job. You are training in so many things. Actually, we are excluded from even that particular work what we are actually designed for would be almost always a danger and a problem. If somebody writes about a woman, in fact, book looks like that. This is one of the WhatsApp. Man means only a few pages, about 10 pages maybe. Things can be finished. Two things people recognize as that emotional flooding, they find it very difficult. This is one of the reasons they find it very difficult understanding women. And second one is actually we are from different planets. Women are from Venus and men from Mars. And this is one of the whole major this thing. And when Indian scientists sent this thing probe to Mars, I was always telling there are no ladies, why these people are struggling so much to send it to Mars. Now you got the point. So there are plenty of data available, why we are different, how we can reconcile and all that. There are many areas we have difference. There is not much time for talking about those things. You talk about arousal, fetishes, pornography, sexual boredom, what men feel, female passivity, sex drive differences. Mostly 1 or 2 points only I will try to. If you try to look at orgasm, almost same time. But to reach that, for a man it is very easy. For a woman it is a very circuitous roundabout route. Many men don't understand this, that's why actually the whole lot of difficulty that happens. Sexual drive. Men is testosterone dependent. That's one of the reasons why want more, have more partners, have more sexual dysfunctions as they age. But women, look at this, intercourse and pleasure are not linked. For many it is difficult to achieve orgasm because there is sentimentality, romance and many such issues come into the picture. Traditional societies discourage. It is a duty than a joyous and pleasurable thing and influence of hormones. And this is one of the reasons. Again and again I am going to talk about this. When you are trying to talk about female sexuality, desire for sex more often linked to the relationship status and social norms. And the social psychiatry is one of the right thing to understand because it's extremely important when you are trying to talk about female sexuality. At all ages, women are more likely to report sexual dysfunction. And if you try to look at, there is a whole data available, corresponding age, there is almost always a problem. Always in our society, girls should be younger. Even a 70-year-old man, he wants to marry that 60-year-old girl. But what science says, she should be 2 or 3 or 4 years older than man, makes the ideal combination. You look at this particular thing. So, unfortunately, that is one of the most common problem what we actually find. And this is Kinsey's report. Women actually reach menarche 2 or 4 years earlier than man. But sexual activity and interest about 3 to 5 times more higher in case of men. Somewhere 35 it actually matches. But you look at socially speaking, at least I practice in Mandya, in the neighborhood of Mysore. Many of the time actually my maternal uncle, sister's daughter, the age difference is about 10 years, 12 years. When our boy is ready, this girl hardly knows anything about. When this girl is ready, this fellow already out. They have to make adjustment. No, you got the point? That's where the difficulty comes in. And what actually has been documented is, somewhere around 40, 50s, you look at female sexuality in general, it is inhibitory type. Almost always. In fact, one can elaborate on one of the Thursday meetings I was talking about female sexuality, why it is inhibitory. Reason starting from evolutionary to biologically speaking, socially speaking, it is there. They become very active, not yet 40. But look at man, age itself, alcohol, smoking, metabolic syndromes, it is a downhill course. Many people who are married and happy what we thought actually gets into the difficulty. Another 1 or 2 points about female sexuality, they can multitask. And this is one of the reasons why almost always sex gets neglected in their life to a great extent. I'll tell you one story. One of this software engineer, she stays in that Mandya, travels to Bangalore to work, about 2.5 hours journey time. She gets up 4 o'clock in the morning, prepares breakfast, a little lunch for parents, in-laws, goes to office, and after 6 o'clock she travels back around 8:30 comes, she prepares the dinner. A little while later she was telling, sir, I am not having any interest at all in the sex, but this is creating problem. See, you look at, here the treatment for female sexuality is not appointing, in fact, treating her with this therapy, that therapy and all of that. Appointing a cook at home is actually the whole treatment. So, they can multitask, and this is one of the things. And this is one of the small clippings here and there that women are always under, what is that actually? Lock and key. Unless she feels comfortable, she is not likely. But this is a very typical way the man sits, exposing that he is almost hoisting a flag. Whether she is an ordinary village lady or a celebrity, women almost always under lock and key. This is evolutionary wise established. Other one, just to wake you up because of the post-lunch, women almost always close their eyes when a very important, what you call, sensual moment. You may be wondering why. Because Very typical story. Anything enjoyable, they close their eyes. Because all uterine tissues are distributed. Unless she closes the eyes and concentrates, it is not possible for her to reach orgasm. But you may be wondering, actually the men almost always keep their eyes wide open. Exactly same. In fact, we are all human beings, but why is this difference? This is because after this girl, who is coming next? He has to keep a watch. So they keep their eyes wide open. So man treatment becomes easy because all erogenous tissues are situated one place. In case of erogenous zones, they are distributed far and wide, and unless a person aware of, in fact, whole body is responsive, how it to make it so. One more other major problem, I'll just mention it and then I'll move forward. Love first, sex next is the theme of female sexuality, means it is actually the sex first, love next. In fact, any number of examples we can give, heart, emotions, and many of these type of things. My wife says sometimes you don't have any feelings. No, you got the point? Whatever feelings means also, in fact, not sufficient. And this is one of the typical story about how we classify this male and female. Men are very fast on the trigger. We are all actually like tubelights in so many aspects of life. But when it comes to sex, we are like candles and bulbs. Look like that, it is already on. Whereas woman, she has been compared to history. You put the plug on, slowly it heats up. And you try to remove it, still it is very hot. Women can be multi-orgasmic, need not have to reach orgasm, and many of the times they are left high and dry. This is one of the common story. And one important point what men found difficult is actually a man can close his eyes and think of anything all pleasurable very easily. But a woman to get happy means there are about 100 things what one has to do. That's where the difficulty comes. That's why the masturbation is easiest. Girlfriend is better. Wife is difficult. All the story in the life is mainly because of related to this particular fact. What Master Johnson mentioned about phases, purely physiological. In fact, that only applies as far as the male are concerned to a great extent. Female, it is not. A linear model can be more than sufficient for us to understand man. It is desire, arousal, orgasm, and resolution. Whereas woman, it is actually something totally different. Whole lot of emotional aspects, reduction, sensation, surrender, reflection, corresponding to what actually Master Johnson had mentioned. And this is from Basson, who talks about, see, for example, in case of man, it starts somewhere and ends somewhere. Whereas woman, it can be anywhere it can start. She will not be ready, but suddenly she can become aroused. She can become responsive. The environment need to be created. That means it is a circular model. That means start somewhere, end somewhere, where actually it begins, where actually it ends, it is actually very difficult to make out. But another point what actually is mentioned very clearly is reaching orgasm. At the peak of orgasm, or in fact peak also, she may be worried about whether the child's bag is ready, whether the curd has set, or something has to be done for the in-laws. No, you got the point? She loses the whole battle in this particular area. And this is what Levin says. Levin is also credited one idea that desire is actually one of the most common issue and disorders are the commonest. And what we basically call the seventh component, what he talks about is emotional satisfaction. See, there are many ladies who present you in your OPD, you might have seen. Husband says she's sleeping so much, but she says, I am not getting sleep. How many other such complaints may be? They are all related to the fact that they are not emotionally satisfied. So those with positive regard, those with negative regard, in fact, our life actually makes so much of difference. This is one of the important points. Coming to prevalence, how common, how actually one can actually interpret. Almost always I focus this particular diagram because unless you look at very closely, you are likely to miss it out. Same story with the men and significantly so with actually women. In fact, one of the common this thing is 1/3 of the men and half of the female population have sexual problems. In psychiatry, you try to treat them with any of the drugs, the problems become double. Exactly. In fact, this is one of the areas we hardly focus, and this is one of the difficulties. There are plenty of data is available which actually talks about multiple phases that people can have problem. Desire appears to be one of the most common important area. And PJ Chandigarh, in fact, the Lendl, Chandraya and other studies, in fact, they're all from PJ Chandigarh. The data at different clinics, what actually like that. But the important point here is actually, I come 1 minute later to what WPS talks about. Axis 1, problem for which actually they have sought help, he makes axis 1A and 1B. B to indicate depression is extremely common and actually we miss it out. Not only depression, it could be even any other medical problems also. So many times, chronic fatigue, minor discomforts, insisting on repeated evaluations, dramatic intensity of symptoms, progressively sedative, relief from diagnostic procedures, repeatedly meeting doctor, in fact unable to relax, unable to give emotional emphasis or emphasize emotional aspects. Many of these type of things may be, in fact sometimes jokingly I always say that this lady is not being serviced properly. In fact, the whole idea here is actually that anxiety or in fact sexuality related issues, the difficulties that may be. We did one long back study. This is not published, but as one of the letter to the editor we had written, married females, almost 50% don't know 30, almost around 84% of the people told they are happy. But this is purely what actually society expects. That's what actually what they say. If you spend little time, you realize that it is not actually the case. Study of sexual dysfunction in 100 consecutive gynec patients. Extremely common. In fact, I'm not going to, because you remember this particular point that sexual problems are extremely common in female sexuality that actually solves. Unconsummated marriages, the whole range of issues. Another thing we have to talk about, desire disorders, what we see in general population. And one important area for which actually, in fact, one of the study what we did was using the sexuality scale by Marston Johnson's which was developed. What actually it reported was almost around 32% of the females reported masturbation sometime and only about 12% of the females reported reasonable comfort. You look at the Western figures, anywhere between 60, 70, 80. Let me tell you, all female sexual dysfunctions what we treat, the whole idea is around training the woman in masturbation. If that is the case, you look at almost about 70% of the women hardly know anything about what actually pleasure as far as our Indian context is concerned. This is one of the major common what we call treatment gap or in fact whatever we call. And lot many other questions. I don't initiate. It is not good for the woman to say. In fact, each question has a different meaning actually to look on. We did a survey of house to house and females married and around 900 plus. What was found was actually almost 38% of the females reported one problem or the other. And this is one of the important data. The whole lot of things like lack of desire, difficulty in enjoyment, lubrication difficulties, and pain during intercourse, all of these things were reported very commonly. And what we actually talk about, female sexual dysfunctions, a comparative study of drug knife, that means depression and other related things, what was actually happening. Another one of the major review about sexual dysfunctions in case of depression, epilepsy and in fact sexual dysfunctions in case of females. A comparative study of sexual functioning of women with the primary headache in India. In fact, this is one of the most common complaint actually which has been documented. Regarding virginity, the anxiety and other related things what they have. In fact, these are the few of the studies. And the other thing, just like in case of men, the psychasthenic syndrome, that why discharge by vagina are responsible for it, so many other 100 complaints what actually they talk about. All of this data is available. Just I'll run a little fast, keeping in mind the time constraint. Asian studies, all of them document very significant sexual problems in the female population and in fact all the varieties of problems. African studies, just you don't have to look at and go into the details unless very particular, we can give you all these slides also. American studies, in the same fashion, European studies, female sexual dysfunction, affective disorders. There is so much of data is available in obsessive compulsive disorder. So, alcohol and other drug related to this thing. All of them actually, what it actually gives an idea is, this is extremely common and somehow this particular area is actually missed out. Look at the classification. In fact, the women are difficult to understand. How many of you agree with that? Okay. Women are difficult to understand. All the ways it is difficult to understand. But you take it from my side. In fact, I am anyway giving oration. Let me talk that way. Even scientists found it very difficult. In case of man, we can make out what is desire, what is arousal, what is orgasm. Women, it is difficult. That's why ultimately, with a lot of confusion to overcome, they made the sexual interest and arousal disorder together. Now, you got the point? Whatever you want to do, you do it. You got it this particular way. This was the ultimate solution because we can't easily differentiate. This is one of the important ones. Another second major group, genitopelvic pain and penetration disorder. sexual aversion disorder has been removed, and now it has been put in what we basically call as phobic related disorder. Hypersexuality and other such things which are terminologies used. In fact, many times a woman showing even any interest at all in work was considered as hypersexuality and other related things in certain situations. So this is a WPS system. Those who are actually doing PG or young people, please look into. In fact, this is one of the things that has not become popular, but we believe from sexology point of view, this is one of the extremely important development that has happened. So axis 1, sexual disorders for which they have come, and other mental and general medical disorder, emphasis here. Don't just collect some problem and stop it. Disabilities, there are about 7-point scale, starting from nil to, in fact, a profound degree of problem what actually they can present. Contextual factors. In fact, from morning we are again and again reasoning about social issues and other related factors. This is what actually the contextual factors matter. Many of the places, the privacy, lack of privacy, and many other such things are extremely common, and many people are not as lucky as staying in Chandigarh. You talk about Mumbai and other metropolitan cities, the problem is actually extremely difficult and lack of privacy. And quality of life, a 10-point scale from nil to significant disturbance. The second component actually in this classification is actually contextualization of clinical problems. That means don't just make, say, ED or other FSD. Why? What actually is creating this particular problem? Patient's positive factors, what are the things for improvement? The expectations of restoration. Somebody wants only injection tablets is actually something totally different from, they are willing to change the process. So this is one of the important ideas. Evaluating FSD, just like in case of man, in fact, there are a lot of areas which are necessary to be, and many of these people present to the gynecologist. One of the good advantages is actually many psychiatrists marry gynecologists. My wife says, I married you because her friends told it is easy to handle psychiatrists. No, you got the point. But all said and done, everybody may have a different way of looking at the problem. Shame, fear, ignorance. This is one of the reasons why actually they don't talk about. A detailed, proper examination is must. If you look at ICD-10, functional disorders, functional vaginismus. But people have done studies to document subsequently that there are actually so many problems are present even in these individuals which were treated earlier as functional problems. So laboratory tests, just like what we do for any other problem, need to be actually done. Range of inventories are available, and again, as far as the men are concerned, for ED, PE and all, PJ Chandigarh has come out with quite a bit of work, and this is one of the major reviews by what we call different scales in what degree of problem, what are the things can be utilized. Sandeep Grover's review in Journal of Psychosexuality has become very popular and highly cited journal. Because of lack of time, I just focus on only one area, the orgasm. This is one of the very top idea which is there prevalent in the society, and inhibition of over control in case of women. But what actually has been documented now is actually what, see, if you look at the DSM classification earlier, there used to be either frigidity in case of females or impotence in case of males. But the thing is, no woman is frigid. It is only pre-orgasmic state. That means if a proper stimulation is provided, every woman is capable of potentially reaching orgasm. All women are capable of having orgasms. Many women, they find it difficult, not because of anything. When we talk about clitoral, anal, vaginal, this, that, and all of that, the multiple classifications, and 70% achieve with concomitant direct clitoral stimulation, but only about 30% will reach. I'll come another 1 minute later for that. Orgasm in 50% of the sexual encounters is average. Many men compare their masculinity with female orgasm, that is a difficulty. And some fake it. In fact, you might have noticed the Friends channel, that lady again and again telling, all through my life I was faking. In fact, this is one of the extremely important points. They are vulnerable for guilt, anxiety, conflict, inhibitions. And this is one of the little complex diagram, but what it actually talks about it, you don't have to worry too much about it, just only to confuse you, I have put in there. The important message is, there is something organic biological, there is something psychological and social, everything has some interrelationship, and this is one of the extremely important things actually to be noted. So there is a significant gap, treatment gap and other things, they are talking about this from the morning. Female orgasm gap, this is from Adarsh Tripathi from Lucknow, talks about there is a wide difference between man and woman. Men are easily reaching, but women are finding it difficult. 3 out of 4 don't reach orgasm. 20% of the females compared to only 2% of the males. So these are some of the data available. This is from clinics of North America. These are all references available. If anybody is interested, we can give you. With fantasy alone, only about 5% of the women reach orgasm. See, I can close my eyes and think of all women came in my life. Very comfortable. But for a woman, you ask her to fantasize, she will fantasize the man, husband, wearing lungi, wearing pants, wearing shirts. How you get aroused? You got the point? By chance, she fantasizes something different, feels so guilty, doing puja, taking bath, and 100 other things actually. In fact, this feeling guilty is one of the major domain of female sexuality, and that is actually responsible for a lot of problems. Only 29 to 32% of the women reach orgasm in intercourse situations. And for all practical purposes, I was talking about masturbation, and the word repeatedly used, and such an amount of data is available on this. Touch. Touch, touch, and touch alone. Self with a partner. In fact, it is possible for every woman to take her to the orgasm. And what we basically call, with vibrator, a woman can be taken to orgasm almost 100%. The data may be actually a little questionable, but all said and done, this is. Once I was traveling from Kolkata to Bangalore, late night flight, around 11:30, 12 o'clock. Any Bengalis in this group? I think Basu is there, na? Okay. Somehow, no, yes, got it. These Bengalis are very talkative fellows. Basu may be a little exception. Those three fellows sitting in the front row, they were chatting. In fact, they were pressing the button again and again. Ear hostess took little time. Ultimately, when she came, this fellow's English was also not good. This is a little problem with some of the Bengalis. I'm not talking about your English. You got the point. This fellow telling, I am fingering, but you are not coming. You got the point. I could make out she was actually thinking about, I need little more than actually fingering. No, this is the precise whole story. So the important carry-home message. One important thing people have documented is actually for men, it looks like it is a physical activity. The terminology screwing, it might have come because of this nut and bolt mechanism. For them, it looks like it is a drilling, boring, or whatever you call it actually. So this is actually what people think about. But unfortunately, when you are trying to talk about female sexuality, the range of other things come into picture. And we are telling again and again, the relationship matters. And the important point, what actually has been found, even when an individual presents to you with some difficulty, you must go through a little more difficulty. This is one of the long back story, around 30-35 years story, I am actually again repeating now. This fellow married, cousin sister's daughter, she doesn't allow this fellow to come near. 4 years. Ultimately went and told mother-in-law, I can't wait any longer, I want to marry somebody. Mother-in-law told him, you come tomorrow afternoon, everything will be solved. It's a big house, he went home there. This girl was running here, there, and like there were about 5 or 6 ladies. Ultimately they caught hold of her, brought to the cot which they had put in the hall. Mother-in-law holding one arm, another lady holding another leg, one lady pelvis, another lady holding another arm. They told, now you do it. This fellow says he removed the pant. He couldn't get the erection. All of them told him, you are not a man, why you are making so much of us? So this fellow comes running and telling us, sir, I am having erectile dysfunction, please treat me. You got the point? Why I am emphasizing this point is, history is one of the extremely important area where we have to spend a lot of time, and unless you make little provision for that. My wife, gynecologist, there is one person is on the cot and another 2-3 people are sitting on the chair. See, how anybody will tell you about sexual problems? Now she has modified, but all said and done, they are so busy with so many patients, they just don't have any time to ask about. So one important point that has to come is actually that one. And when we are trying to talk about female sexuality, the management, the sunset focus, and lot many things we talk about, all are based on one simple point. It is training the woman in masturbation, trying to understand her body, trying to help her actually understand her body. This is all the whole sunset focus exercise are about. Multiple approaches actually one can. What is we are seeing in the drawing room is separate actually from what is actually might be having in the bedroom. There are a whole lot of issues. So the important point is actually extremely important to document that female sexuality problem present and how it can be overcome. When we are trying to talk about female dysfunctions, it is a multifaceted. Everybody is necessary for attending to this. It is a multifactorial also. Desire, arousal, pelvic, pain and penetration and such other disorders in that particular category. Team approach, psychiatrists, psychologists, social workers, everybody's role is actually there very significantly to a great extent. And the treatment options, pharmacological just doesn't work as far as female is concerned. There are a whole range of non-pharmacological treatments which are necessary. And if you try to look at female sexuality, is inhibited one particular point, but there are multiple areas which actually affects, in fact, the female sexuality. Some of the important, just to bring out, say maybe childbearing. God intended that, in fact, she should be nursing the child, not about sex. Whole lot of changes there. Patriarchy, marriage. See, girlfriends are so nice, but once marriage, the problem comes. Because the female orgasm depends on what we basically call oxytocin. Oxytocin is bonding, relationship, and these are the issues which are necessary. Anybody in a romantic situation, any new person, in fact, that electric shock sensation, what we talk about. You are traveling in a bus and a nice, beautiful lady came and sat next to you. You felt a little warm. In a romantic situation, that sensation, sensitivity changes what we talk about. But in the marriage, what happens is, the girl is made to hold the hand of this boy, or the boy is made to hold the hand of the girl, and they have to go for 7 fera. Tolerance develops very fast. Girlfriend so nice, but once she has become wife, that enthusiasm and adventurism and a whole lot of that particular sensation goes off. Very fast we develop tolerance. It is almost like I am putting the new shirt, I feel that sensation for 1 or 2 minutes, but subsequently it is not there. That's why till marriage, no problems, and after marriage, so many problems. This is actually one of the most important points. And second, there is actually negativity bias. I still remember one of our medical students came and told, sir, I'm actually, still, how many minutes are there? Okay, fine. She came and told, I did a mistake. Then what is the actual issue? She says he was 1 year batch senior and she saw him in the library. He used to sit and read in the library. So let me tell you, those girls who are not married here, any man who goes to the library and is sitting and reading and not looking at the girls is not worth marrying. No, you got the point. They have to be a little naughty. No, you got it. Sir, this fellow has no interest. This is what precisely happens. Highly intellectual fellows, only exceptions may be but Dr. Basu and things like that. No, you got the point. Highly intellectual but still romantic. Indian research, so many problems. People have documented, in fact 70% new importance, gynecological clinics and the data that is available. 82% had no sexual problems, 61% could talk about. A lot of methodological problems with the data what we have. Challenges in taking sexual history, female. And we talk about doctors asking questions. They don't ask mainly because it is a private matter. If I ask questions, what will actually happen? And the frequency of sexual dysfunctions in patients attending sex therapy clinic in North India. In fact, all of them have recognized, what is actually they have recognized, it is all in her head. And this, that, in fact, ultimately she is blamed for each and everything what is actually might be happening. So, only solution is actually the education and sex education. We are all well aware a girl is actually educated. In fact, her marriage is, actually gets postponed to some extent to another, in fact, where actually education was missing. And being educated, particularly in sexual matters, would actually, she can make her decisions properly, making use of. So, sex education becomes one of the most important area for understanding. There is actually 2 different aspects. One is actually we talk about pleasure, another one is actually happiness. There are 2 different dimensions. One can talk for hours together on these 2 points. But the important point, actually what we will be missing is this particular area. And many of the times, in many of the situations, what you might have noticed, she is made to resign from the job. She is made to just take care of certain things. This way, we have to have certain things which actually work for the betterment of the individual. Dopamine. There are a lot of activity which she needs to do rather than just confining herself to certain limited activities. Oxytocin. In fact, how you build a relationship, this is going to matter to a great extent. Endorphin. In fact, hardly we have found quite a few ladies just don't do any exercise and all, like household work, of course that is true, but little more extra necessary. Serotonin. In fact, she is capable of giving love and a whole lot of things, but all said and done, lot many other things she is capable of. She is made to resign and do certain things which are actually not in consonance with her personality. We reviewed some of the drugs which have been actually introduced now for female sexuality. Fludarcerin. We are all well aware of 5-AST1A. In fact, this is actually facilitatory. 5HT, 1B, 1C, or 2A, 2C. In fact, all of these type of things can produce problems. While choosing the drugs, choose a drug which actually beneficial and which acts on 5HT, 1A mechanism. Man, it applies, and even for a woman, this is one of the very important things. And when you are trying to talk about antidepressants, of course, we are all well aware serotonin as one of the best molecule what one can think of, or dopamine-related drugs, they may be necessary. And flibanserin, if somebody is not responding by 8 weeks, no meaning in continuing it. This is what actually what these studies talk about. Brimaronotide, injection, parenteral form, melanocortin mechanism, of course, not much experience we have, but all said and done, it has not stood the test of time. Sildenafil citrate, in fact, we were one of the initial people who did the study on sildenafil citrate as far as the males are concerned. Females still is off-label. Some people have used it, some benefit, because the swelling lubricatory response, what we are talking about, it may have beneficial effect. And now we are talking about topical sildenafil cream for female sexual arousal disorder and things like that. And what one should remember, if sexual interest and arousal disorder present, orgasmic problem is bound to be present. So treat these type of things. Ultimately, when we are trying to talk about female sexuality, very comprehensively we need to involve many aspects. One is actually what we are talking about is non-pharmacological, the lifestyle issues. They are all beneficial. Whether you talk about yoga, you talk about weight loss, you talk about exercise, each one. In case of man, see, if a man can perform exercise for about 20 minutes, the DHA level increases by about 2 to 3 times at the end of about 3rd week or 4th week. We feel all happy because we do exercise. That means the remarkable benefits actually it may have. The most important point is actually that psychotherapy, including in fact sex therapy and marital therapy, family therapy, all of these things have a role. This particular diagram is extremely relevant, that's spare time. That's what actually I was telling. Many women are actually not given enough time to actually relax. In fact, this is the one important point one should keep it in mind when we are trying to talk about. In the same fashion, of course, lubricants and physiotherapy and many of those type of things actually people have used. So in conclusion, what one can say, sex is a conversation carried out by another means. And contempt of sexuality is a crime against life. Improve communication. I have focused this particular diagram not only to emphasize that between couple. We doctors must start asking the question whether there is actually some problem there. If you do that, you will be sexologist. We published quite a few, in fact, intimacy matters, elderly sexuality for a geriatric sexuality conference a little while ago. Relationship matters with Prof Rao, that this is one of the extremely important component which actually one need to be. Relationship and caregiving elderly. This book is available in Amazon, that how precisely, in fact, apart from many of the other aspects, the sexuality is also one of the extremely important aspect. In many of the families, what happens, there is only 1 bedroom or 2 bedrooms and 1 daughters, and they occupy it, and this Buddha Buddhi are totally thrown out from that particular place. Literally, in fact, keep it in mind, this particular aspect. Last time in Social Psychiatry Conference, we released this conference about third gender and issues related to maybe LGBTQ and other related aspects in a great extent. And this is the book which is under preparation, Embracing Eros, Navigating Intimacy, Sensuality and Touch. How and why, in fact, the female sexuality matters, and we should not neglect this particular area. Legal practice guidelines. We have, in fact, the sexual dysfunction available in great detail if those who are interested. And this other book on the right side, when Dr. Indira Sharma Madam was the guest editor for this, we covered quite a bit of issues related to the female mental health in general and female sexuality in particular. In fact, this is one of the articles, female sexuality, how actually it matters and how actually one should go about. We have this Journal of Psychosexual Health, where is one of the topmost journal now at present, and we have this training program to see that, in fact, how best we can contribute for the life. IPS textbook of sexuality and sexuality, I was one of the co-editors for this. So plenty of data is available now. Female sexuality is important matter, and for men, you want to be happy, you need to understand women. And women, you need to understand that you have to not getting just angry with the men, but make them understand what your needs are. In fact, many other times. In fact, if you try to look at man's brain, our brain is very active in some of the areas. One of the few areas where it is actually problematic is empathy, cognitive empathy, or if I talk about emotional empathy, we are actually very poor. Tomorrow is your birthday. Your silence you will understand, and you will remember your birthday means you are going to be disappointed. You tell him that tomorrow is your birthday. You tell him I want Kanjivaram silk saree. He will bring it. Now you got the point? Don't wait for, sir, I prepare such nice food. This fellow hardly tells anything. But does he eat? He eats quite well. He is eating quite well means he is telling that you are. You women are actually God's gift that you can talk so much. Men are actually have been not allowed to. In fact, you ask him how was the day, maximum he will say it is good or bad. So even your good preparation of the food also is not likely to respond properly. Don't get disappointed. That's this particular change. Let it come. With these few words, let me thank the organizers for this wonderful opportunity what you provided. Thank you very, very much.
Thank you, Dr. TSS Rao, for this scholarly lecture which has kept the audience well informed, especially a matter which has not been discussed commonly. Now, being in oration, there are no questions, but I will hand over to co-chair, Person Mangasur, for her concluding comments.
So, thank you, sir. So, it was a very well given lecture where you have summarized about female sexual dysfunction and with some very provocative pictures plus provocative statements, but I think all those were made.
Many got provocated by this picture.
All those were made to kind of make your point. So I think we all have learned a lot. So thank you very much.